in Ayurveda, there's no concept called autoimmune at all. And people think it's only the digestion here, but that's not it. And people have a misconception that Ayurveda is slow. It's not. In fact, it's much faster than any kind of other medication. Sarvangasana is something we recommend to all thyroid patients. That a lot of people think Dahi is very healthy. Dahi is not healthy. The body is not going to accept it because it doesn't recognize chemicals. Your body starts to detox between 10 and 2 AM.
Hello and welcome to this another edition of our conversation with Siddhartha. And last time it was very well received and we had touched a lot of topics. So everybody asked us, to go deeper into the subjects. So what we've decided is to do a series of conversations about specific areas. And to start with, I thought that it would be interesting to talk about autoimmune diseases and the condition of autoimmune. So Siddharth, welcome to the show, and I think we have some great conversation to have and great subject.
Right.
So let's talk about autoimmune because I think a lot of people are having that problem. What is autoimmune?
Okay, so firstly, one needs to understand that in Ayurveda, there's no concept called autoimmune at all. Secondly, when it comes to immune system, the modern science or allopathy considers immune system with 9 specific organs, like they say mucosa or the skin or the thymus or the bone marrows, etc. But Ayurveda, in fact, if you see immune system in Ayurveda, that is Vyadhi Kshamatva, is just one small part of the immune system. Otherwise, there is something called Ojas, there is something called Agni, there are 3 types of Agni, and also there are other factors that need to be considered when it comes to the immune system of a body. Okay, so in Ayurveda, when we talk about autoimmunes, in autoimmune conditions of human beings, for example, let's say psoriasis or these kinds of skin-related issues, in allopathy or in modern science, these conditions cannot be reversed. Okay, in Ayurveda, they can certainly be reversed because, as per us, this is nothing but overload of armor in the system or toxins in the system. When we say overload of armor, we talk about undigested food. Like, let's say, for example, I am very hungry now suddenly, and then I start eating a lot of food. There comes a point where my hunger is gone, and I still keep eating. Okay, so the moment my hunger is gone, when my body is satisfied, that extra food that I am eating is an overload, and that food does not get digested by the body. When it does not get digested, it has to go somewhere, right? It does not all go out down. It also gets absorbed. This undigested food also gets absorbed by the body. When that undigested food gets absorbed by the body, there are 3 types of Agnis. One is Jathar Agni, the second one is Bhut Agni, and the third one is Dhatav Agni. Now, these Agnis cannot act in the right way. Now, just to explain to you what Jathar Agni is. Jathar Agni is essentially the Agni that is the digestive system. As you know, when we talk about digestion, people think it's only the digestion here, but that's not it. There is something called cellular digestion as well. Now, Bhut Agni, for that matter, is whenever we eat food. If you remember in the first part, I talked about food being converted into cells. Yeah, and that's exactly what Bhut Agni is all about. When you eat something in Jathar Agni, they break the food down, and then this food has to be taken to different parts of the body. Okay, creating certain cells. Yeah, right, the new cells in your body. Now, this basically your Pancha Mahabhutas or Panchabhutas, as we call it, these are then used from the food. It's taken from the food and to create these new cells. Okay. Now, when cells are formed, after that you have the Dhatav Agni. Now, Dhatav Agni is when a cluster of cells, like let's say you have liver cells. Okay. Now, a cluster of liver cells forms a liver tissue, and a cluster of liver tissues form the liver as an organ. So that is the Dhatav Agni. So you see what all is considered when we talk about in any kind of immune system or any kind of organism, how they function. Okay. So that being said, I think what is another thing which is very important for us to understand is why is it that the body is doing this? Like in allopathy or in modern science, they say that the body is attacking itself. The body will never attack itself. Okay, it's just rogue. The cells have suddenly gone rogue. And why have they gone rogue? It's because of your doshas. Yeah, as we call it, the mRNA, rRNA, and tRNA, that is Vata, Pitta, Kapha. There is an imbalance. Okay, once there is an imbalance of all these three, it starts sending wrong signals to your cells, that is your DNA and your cells eventually. And then your cells have lost its memory and it starts to behave abnormally. Okay.
So losing of memory is what you are talking about is autoimmune.
Exactly.
That's an interesting perspective to autoimmune, which is not obviously considered by allopathy.
That's right.
Yeah.
Exactly. So what we do is any autoimmune disease or any kind of disease, when when the patient comes to us, we completely understand which RNA has been destroyed or imbalanced. Then we start giving adaptogenic medicines or these herbs which actually treat or improve the RNA, okay, balance it, so that the DNA can then be repaired, okay, and eventually the right signal goes to the cell and hence the memory starts to improve.
But what causes, just all of a sudden person is normal, mostly this hits in the late 20s or in the 30s that you start you're seeing these cases of autoimmune. What happens at say 25, 35 that autoimmune suddenly flares up?
Right. This is a very good question. In fact, what we see today is the Western world has huge amounts of autoimmune diseases compared to what we see here in this country. But the reason being, one is your poor lifestyle. I think the biggest mistake, Karan, today, which everyone, especially the kids, are doing is to sleep late and wake up late. The moment you start sleeping late and waking up late, not sleeping by 10 o'clock and not waking up by 6 o'clock, your body, your circadian rhythm or the dinacharya that you follow, the circadian rhythm gets completely destroyed. Your body stops detoxing because your body starts to detox between 10 and 2 a.m. 10 p.m. and 2 a.m., which is the Pitta Kal. That is when your body actually starts to detox. And then the Vata Kal, which is after 2 o'clock, between 2 and 6, is when the body pushes out the toxins. Now, if you're awake during that time, your body is not able to do that, right? So what happens? There's a toxin overload inside the body. And when there is a toxin overload inside the body, your body at any given point in time, I think I spoke about this in the first podcast as well, that there are metabolic channels and pathways inside the body. So these metabolic pathways start to get choked. Now, at the age of 20, if during our times we didn't have so many chokes because we followed these, right discipline. We were disciplined. We followed the dharma and we followed the concepts of Ayurveda. And now the kids don't follow that. So they started getting autoimmunes at 20 and 25, which, our generation must have got it at 50 or 60. And our grandparents had never got it because they followed an Ayurvedic lifestyle. So that is one reason, a poor lifestyle. Second is a very wrong and poor diet. Today, everyone eats outside. I think we covered that in the first podcast. Second is extreme addiction to chemical foods or processed food. When you eat processed food, again, the three Agnis are not able to perform properly. And when that happens, half the food remains undigested. And this undigested food then starts to choke your channels. And eventually what happens is your body stops performing its, normal duties.
How do you define a processed food?
Anything which is packed is processed. So I would say this, that anything that you see is packed needs to be, some chemicals to be added to it, right? So instead of going to a supermarket, I would suggest buy from your local farmer, buy from your local, vegetable vendor, and cook home cooked food and eat at home. The moment you eat outside, you have no idea what kind of raw materials they are using for your food. You have absolutely no idea what kind of chemicals have gone into it. And the moment you eat chemicals, the body is not going to accept it because it doesn't recognize chemicals. A natural body will never recognize chemicals, and that's where your cells which are born, the new cells which are born, are zombie cells. And these zombie cells, or asuric cells as we call it, then start to behave randomly. And that is exactly why you have this young generation who are much more diseased than their parents. They are looking older than their parents. They have mental health issues. All this is because of that.
So, modern immunology says that immune tolerance breaks down, but Ayurveda speaks of a concept of Pragya, Aparad, which is, some people say, the mistake of the intellect. And could you explain this?
I love this question. This is a brilliant question, Karan. The Aparad or Pragya Aparad that we say is something which all of us do at some point in our life, which is wrong choices. Yeah, but at the same time, if we are told that this is, if you do this action or this choice, if you make this choice, this is the result, a smart and intelligent and a wise person would stay away from it. Like, for example, if someone asks you to have weed or drugs, a smarter person or a wise person would stay away from it. Some kids, sadly, cannot stay away from it because they think that that's the right thing to do, to look cool or be nice or, join the gang. Now, when you do these kinds of aparads or these kinds of mistakes, there is a karmic, hit on you in the form of disease. It can be any kind of addiction. It can be food addictions, it can be junk food addictions, it can be smoking, it can be drinking, it can be thinking negatively. So all of this is basically, aparads or pragya aparads, which actually lead or pushes an individual to a disease. It can be an autoimmune, it can also be cancer for that matter.
So, what have been the typical autoimmune cases that you have seen in your clinic, and what has been generally your line of treatment, and how soon can a person see benefit or cure?
Right.
Like there's Hashimoto is another thing that is very common.
Yes.
There's psoriasis, which is very common. Some of it is just irritating to the person, some of it is extremely debilitating to the person.
Right.
So how do you have different lines of treatment, or how does it work?
So Karan, first of all, we get a lot of autoimmune patients today, whether it's Hashimoto's, whether it's psoriasis, whether it is any kind of joint-related issues. And all of this, or leaky gut for that matter, or Crohn's disease, all of this can be easily reversed by Ayurveda. Yeah, number one, because it's an overload of toxins in the body, and not just overload of toxins. It has gone up to that extent where any amount of medication is not going to help, and the allopathic system cannot detox. Okay, a lot of people do these vegetable juice detox or fruit juice detox or eat fruits. That's not the way to detox, because in Ayurveda, when we talk about detox, we have to go into the cell. We have to cross the blood-brain barrier, and a single cell has a cell wall, and then it has a nucleus inside. Now it also has mitochondria and DNA and chromosomes inside. Now this cell, nature is so beautiful and our body is so perfect that it takes a hell of a lot of effort to actually penetrate that. There is no allopathic medicine which can actually penetrate into the cell. But Ayurvedic medicines, because it's herbal, and because it's adaptogenic, can easily pass through, because the cell is natural and it allows anything which is natural to come inside. It welcomes it. Okay, so we can go into the cell, remove all the toxins from inside, or this armor which is there from inside, and then the cell starts to perform its duty, gets back its memory, and then it becomes a beautiful normal sur, or it's not a zombie cell anymore. And that's how we treat. And that's the treatment for every individual is different. Since you asked the question that, how is the treatment? In fact, if we have 8 billion people on the planet with 8 billion the same disease also, or 8 billion diseases, we will have 8 billion protocols. So we cannot have the same protocol for any two individuals.
So what is the first, like, how do you test for whether it is autoimmune? Is it like some Nadi Shodhan, or do you what are the typical signs a person should notice when he says that he must come to you, and because it may be autoimmune? What do you think he needs to look out for?
So there are, the body starts to show signs probably 10 years before you have an autoimmune. Okay, it's just that you've been ignoring it, right? Now, when, for example, let's say in Hashimoto's, the thyroid gland is starting to slow down, or it's starting to get overactive, then you've not paid attention to it. But in fact, what would probably happen before is you've been sleeping late, waking up late, you've been eating trash, or you've been probably having dahi every day, okay, which can create chokes in your channels. So that will create some kind of issues, like even a simple headache, a lot of constipation for long periods of time, years of constipation, not being able to evacuate properly on a daily basis. Okay, these are very, very strong signs that you're moving towards a serious disease. There can be aches and pains of joints, like when you wake up in the morning, you feel this joint pains in your fingers or below your feet, and for the first few seconds or few moments you're not able to walk properly, but then after 5 minutes you're fine. So these are signs. Okay, the third can be having headaches on a regular basis. Okay, and not figuring out what is the reason you have these headaches. So these small issues probably you've had for the last 10 years it pushes you towards a certain autoimmune. It can, or any kind of addictions for that matter, yeah, alcoholism, or can lead to several autoimmunes. Smoking can lead to autoimmunes. Then people have no idea. People think there are only cardiovascular issues or lung related issues. No, not necessary. There can be all kinds of addictions can lead to, even chocolate for that matter. People think chocolate is harmless and it is it's healthy, especially dark chocolate. It's not. It actually if you see under an electron microscope, when you eat it, the moment you eat a chocolate, the blood vessels in your body, it dilates but 10 times the size. A normal size, it dilates 10 times. So imagine you eating this chocolate every day, or 3 times a week, or twice a week. So if it goes 10 times, now there's some elasticity to your blood vessels. What happens eventually to such people is your capillaries, or we call it dhamanis, they start to become crooked. And nothing in the world can actually make them straight again, or how they were again. Yeah, so that's where Ayurveda comes into picture. Like, I don't think allopathy has any ways of doing that. Then they'll just give you steroids, or they will give you, which is really detrimental for your health. So what we do is we then change your lifestyle. We stop the root cause of the disease. The main idea of any nidan, a proper nidan by any Vaidya, is to find the root cause of the disease. So once the root cause is known, then it is very easy for us to actually treat the patient. And in Ayurveda, we know ways by which we can straighten out these capillaries or dhamanis. We know how, by giving bastis or specific medicines. Like I said, the cells just welcome the adaptogenic and herbs because The moment you take these kinds of herbs, within, we've seen cancer patients, in fact, within 15 days of starting our medication, starting to feel relief. We have patients who have had serious pain and health issues within a span of just 5 days or 7 days of taking our medicine, and they have relief. And people have a misconception that Ayurveda is slow. It's not. In fact, it's much faster than any kind of other medication. Yeah.
So because other medication is actually just managing it, it's
Exactly.
not curing it.
And people need to understand this, that in allopathy or in modern science, what they do is there is a certain dose that needs to be given. What is that dose? That it has to push into the cell, or it has to push it, because the body is not accepting it. You put a small amount, the body doesn't accept it, because it's a natural thing. The body is nature, and it doesn't accept anything unnatural or artificial or superficial. So what does it do? It rejects it. But we have to push in a larger dose so that at least something goes into the system, and it is made bioavailable. That's why you have this concept in allopathy which says it should be made bioavailable. Whereas in Ayurveda, you give even so much, it's made bioavailable. It's easy because it is already bio, right? It's a natural thing.
And I think there's somewhat similarity in homeopathy as well.
Yes.
Contrary to allopathy, homeopathy believes in doing 1/100th, 1,000th of the medicine. And,
exactly.
It obviously breaks the cell barrier.
That's
and goes in.
Yes.
So there are sometimes portions.
Absolutely.
You mentioned a little bit about thyroid. I think that is something which it's almost an epidemic now. You know, to have any of the
especially
popular,
women, I think.
Yeah, like the thyroxins of the world or the drugs of the world. And I think people keep increasing their dose.
Yes.
There is very few people reduce their dose. They every time they go to the doctor, they're told to go from 25 mg to 50 to 75. What is your general, if you focus a little bit about on this thyroid and
so thyroid, conditions like thyroid or Graves' disease, or which is also thyroid, or Hashimoto's. Now, Graves' disease is also an autoimmune. Hashimoto's is also an autoimmune, which can eventually lead to cancers also. Like Hashimoto's can lead to cancers also, or thyroid-related issues, which can, which cannot be sorted when it comes to allopathy, can easily be reversed by Ayurveda. Now, a simple thing like, the moment you get a thyroid related issue, if you come to a Vaidya, he can probably reverse it in just 2 months or 3 months. But, what most of the people do is they will go to a GP to take a thyroxine and then prolong it for the next 10 years. And then when their dose increases, then they'll come to us. By the time, it's a little difficult. We can still do it, but it's a little difficult. But there are ways through lifestyle changes, through dietary changes, medicine. Then, of course, there is panchakarma or detox, by which we detox the cells and the armor in the system, which is exactly the reason why they have got the thyroid, and yogasanas. I would just like to give a tip to every thyroid patient here that there is a yogasana called Sarvangasana. They should do that every day for at least 60 seconds to up to 2 minutes, or sometimes even a little more if necessary. So, Sarvangasana is something we recommend to all thyroid patients. Yeah.
And on the note of asanas, what is your opinion on pranayama to reverse or to manage? Because there's a lot of conversation which is about nitrous oxide.
Yes.
And how a certain like just doing pranayama
Right.
or anulom vilom
Yeah.
energizes it, and so.
Like if you have blood pressure issues, one, Ayurveda can reverse it within just a span of 2 months. It's not a big deal.
2 months?
2 months,
Wow.
absolutely. We recommend Anulom Vilom to anyone who has sudden spike in blood pressures to immediately do Anulom Vilom as we know it, and instantly the blood pressure goes down. Of course, that's not a cure. For that, you need to, give medicines for the brain as well, and medicines so that the stress level in the body reduces. When it comes to cancers also or autoimmunes, we give something called as kumbhak. That is a brilliant form of pranayam, which can really, in fact, one of our Vaidyas has, done a research on this kumbhak and how it works on cancer patients and autoimmune patients. And it really can help in reversing and facilitates the body to be able to detox, it's easier for the body to detox when you do a pranayam, because, very few people know that even you don't lose weight actually by sweating. You lose weight by breathing through breath.
Yeah.
Very few people know that.
Fat is burnt in the lungs.
Exactly. Fat is burnt in the lungs, not in the not by removing the water content of your body.
And the reason why people run or walk is actually to get more oxygen into the lungs,
That's
so that
right. That's right.
so there's more fat burning.
Exactly.
But a lot of people don't.
Exactly.
But let's talk about the. Is there any caution which one should have in pranayam?
Yes, very good question again. We speak to a lot of our patients we do get patients who come to us with, who've done a lot of kriya or who've done a lot of pranayamas, and they have psychological issues, or they do have mild forms of schizophrenia. So when you are controlling your pran, basically what is pranayam? You are controlling your pran. So when you're controlling your prana, you have to be very careful, and you have to learn it from a professional who really knows you and knows how to, you shouldn't be like Abhimanyu, where you know how to go in but you don't know how to come out of it. So you have to be able to just control it and do it in a balanced way. You don't need to overdo it. Overdoing anything will cause harm. So even pranayama, overdoing it also will cause harm. So we suggest that you do 5 to 10 minutes of pranayama. That's more than enough, and kumbhak is good enough for 5-10 minutes. Anulom Vilom also can be done for 5 minutes, perfectly fine. Yogasanas can be done for half an hour, 40 minutes. You don't need to work out too much to be able to lose weight or to kickstart your metabolism or to improve your health, for that matter.
So in your clinic, they also look at yogasanas and yoga?
Yes. Okay. So Karan, when we treat a patient, first of all, Ayurveda is incomplete without yogasana. So when we treat a patient, we have to give them a lifestyle change, basically dinacharya. We have to give them a dietary change, which we start with a Langan diet, and then make sure that they avoid certain kinds of food in case, like for example, dahi. I would want to say this on this podcast, that a lot of people think dahi is very healthy. Dahi is not healthy. In fact, Ayurveda says dahi causes abhishyandi, which means that it chokes the channels and it causes tumors. So dahi is applicable only down south, where you have very hot weather. There a little bit of dahi works, and mind you, down south, the traditional way of making dahi rice is by putting chalk in it. That works. That cuts off the chemistry of the dahi, which is basically sticky in nature. So that is something which I wanted to talk about. Now coming to your question,
about the cautions of pranayama and how you incorporate into your
right. Yeah. Then the third one is medicines, of course. We give adaptogenic medicines. Most of our medicines are obviously herbominerals. And fourth is yoga and pranayama. Fifth is panchakarmas, wherein we detox the organism. Like there are several methodologies of doing that based on which panchakarma suits which patient. And five, which no one does, I can guarantee, which is called as Achar Rasayan. Now, Achar Rasayan is behavioral therapy. We actually give a document to every patient where we talk about what kinds of behavioral issues they need to change or alter, or we just give them a document, say that just follow this and tick mark, and you know, incorporate this in your life.